Hi guys, welcome to Smart PT. This week I want to talk about what you do when you find a spinal instability. Fortunately, they're not as common. In my practice, I would say most people who are coming in, probably 80 or 90% of people with a biomechanical dysfunction are presenting more with a hypomobility type of syndrome or fixation. But there is that 10 or 20% that have an underlying instability that's potentially causing their hypomobility or their spinal dysfunction. So what do you do in those cases? They are a lot more difficult to treat because it requires a lot more client active involvement to fix the problem. After you've performed an assessment, you should have been able to determine, is the joint hypomobile, normal mobility, or is there an instability in the region? We do that through stability testing when we see that the joint motion seems to be excessive at a particular level. So we do stability testing, which are pure directional tests that shouldn't naturally happen because most movements are combinations of movements that need to occur together rather than pure directions, anterior, posterior, lateral, or rotational. So if you want to familiarize yourself with those kinds of tests, that's a great idea because it'll help you to find spinal instabilities. Sometimes we'll see the instability right after or during the assessment, and we'll make our plan of attack to address that immediately. Sometimes the joint will appear like it's fixated, and what we'll do is assess for stability after we reduce that fixation or improve that fixation, and then maybe find that there's an underlying instability. The joint will continue to fixate and have dysfunction if you don't address the underlying instability. So what do you do clinically for treatment when you find instability? It's mainly muscle activation work, in my opinion. This is why it's so difficult, because the client has to do the bulk of the work once you find the problem. For example, if we're talking about a lumbar joint, we want to do core activation work. Why is the core important? The core creates stability in the region without producing compression. Sometimes compression in an irritated facet joint can be uncomfortable. Occasionally we cannot build the core to a sufficient level, so we do need to use the larger muscle groups adjacent for more of a bracing technique. Not preferential, however, because those muscles are more involved in movement rather than stability, and they get a little bit sore and angry if they're asked to do dual roles. So ideally, addressing the core is the best strategy. When we're talking about the lumbar or sacroiliac region, for example, there's 4 muscle slings, groups of muscles that work together to create stability. There's the anterior, which is basically from the obliques over to the contralateral hip adductors and flexor group. There's the lateral, which is more the gluteus medius minimus and the contralateral hip adductor group. And then there's the deep and superficial posterior. The superficial posterior includes the latissimus dorsi through the thoracolumbar fascia into the gluteus maximus. The more deep posterior would be the erector spinae through the thoracolumbar fascia to the contralateral gluteus maximus, sacrotuberous ligament, hamstring group. So we're going to use these muscles with exercises. These are the common exercises that we do quite often. So for example, to activate the anterior sling, you could do a dead bug type exercise or an isometric crossbody flexion type exercise. To activate the lateral sling, it would be more of a side plank, maybe with a top leg lift. For the deep posterior, that's more your bird dog type exercise, your arm and opposite leg extension and prone kneeling. And for the more superficial posterior sling, I tend to do a bridge where I brace through my arms a little bit, pull a little bit into extension and adduction to engage latissimus dorsi, and then I do a bridge and I can alternate leg extensions if I like. So basically that's an example of how to find and what to do about instability when you find it on assessment. If physiotherapy is unsuccessful, there are other options to look into. I'd encourage you to look into prolotherapy and PRP type treatments. I find them to be highly effective with my clients who fail to gain the stability required through this kind of exercise training strategy. I do believe this is the best way to start though, because without proper core muscle activation, it's difficult for the passive structures to work alone. We need basically form closure and force closure to create stability in the region.